Hello, everyone. It's Monday, April the 19th. I don't know how you celebrate, losing 8 great West Virginians, but, when we go over the weekend and we go an extra day because, you have your briefing on, Monday, Wednesday, and Friday. Friday, you've got Saturday, Sunday, and then today. So you've got really an extra day. We lost 8 people through that time period, and that's showing remarkable improvement, but to these folks and all their loved ones, it's surely not improvement, But our 2,778th death in West Virginia is a 91-year-old male from Raleigh County. Our 2,779th death is an 81-year-old male from Wood County. Our 2,780th death is an 87-year-old female from Hampshire County. Our 2,781st death is a 63-year-old female from Kanawha County. Our 2,782nd death is an 81-year-old male from Kanawha County. Our 2,783rd death is a 92-year-old female from Harrison County. Our 2,784th death is a 63-year-old female from Berkeley County. And our 2,785th death in West Virginia is an 88-year-old male from Mineral County. We didn't test a lot over the weekend, but our daily positivity rate jumped up to 6.03. Our cumulative rate still held steady. In fact, it eases down at 5.21. The number of active cases we have in West Virginia are 7,388. Remember, not long ago, we were approaching just right at 5,000 or maybe even a little less. We have recovered cases of 138,974. That's good. Hospitalized, we're still above 200 at 232. In the ICU unit, we're down a little bit, maybe not from Friday, but we're 60 people in the ICU unit. And we really only have one red county now, and that's Berkeley. That part is good. From a standpoint of a reminder to all those 65 years of age and older, you see the ages that I read again today. The youngest of all these 8 was 2 63-year-olds. But if you're 65 or 50 and above, whatever it may be, if you're feeling the least bit bad, please go get tested. If we were to come back with a positive on you and everything, absolutely we could give you the antibodies and save your life if we can catch it early enough. It's really another safety reminder and everything that as far as the J&J vaccine, there's probably a lot of argument that it should have never been stopped, but from a standpoint of trying to be super safe, we halted the J&J vaccine for at least now, but we're still seeing, we're not seeing any events with the Pfizer or the Moderna vaccine, and it is absolutely still continuing to come, and we have more vaccines than we have arms for right now, and we're continuing to try to hit 100% every week and everything, but as we get to the end of this rainbow, like I've said many, many times, this is nothing but a math issue. If you look and think we have delivered total number of doses that have gone out in West Virginia have been 1,352,000, if this is correct. That's a total that have been received. Well, I'm sorry. It is 1,162,000, and the number of people that we have absolutely put first and second doses total in people's arms, 681,000 for the first time. Now just think about this. Do the math. I always believe in doing the math. If we've got 681,790 first doses, forget the second doses for right now. First doses are right at 700,000. In the state of West Virginia, you've got almost 400,000 children under the age of 16. If you put the two together, you're almost at 1,100,000, and you've only got 1,750,000 total in the whole state. So in other words, you're now, really, for all practical purposes, you're 2/3 of the way there as far as the number of people that have received doses versus the number that are eligible to receive doses. The kids up to 16 are not eligible, but they surely count in our population. If you'll just add those kids into the first doses, you're going to find a number that's sitting right at 2/3 of our total population. And what does that mean? It means just this, that there's some people out there that, you know, and bless their hearts, I love them with all my soul. We all have the right to decide. But really, I'm a firm believer we don't have the right to decide when it could endanger someone else. And so I just urge them with all in me to get their vaccine. We're down now to where we're really looking at 1/3 of the people, so naturally we're going to slow down. We have to slow down because some of that 1/3 of the people and everything just are either hard-headed or whatever it may be about taking the vaccine. And so it is going to slow down. And it is going to be a bigger challenge to continue to get arms and get absolutely our doses all out in people's arms. But we're continuing to work that, and that's what we'll continue to do. Your vaccine eligibility, you know, anyone 16 years of age and older is eligible. We look for you to pre-register. I am urging the young people, especially right now, and their older people to help me. Help me make sure that we get our 16 to 35-year-olds vaccinated. It is really, really, really crucial and really important. We're at 85.9% of the total administration rate for first and second doses right now. Goal's always 100%. Like I've said just a second ago, we have gotten in arms 1,162,079 total doses. That's first and second round. As far as our saving our wisdom, you know, this is also for people that are 65 years of age and older. This is also first and second round doses, 476,720. We're above 75% of those 65 years of age and older. We're trying really hard to get to 85%. If you can help us with that, if you know someone that's wanting to get vaccinated and they're 65 years of age and older, please contact us if they're having any trouble whatsoever, and we'll get it done. We're pleading over and over with our businesses, manufacturing, our churches, and pastors all across this state, our schools and ball teams and whatever it may be. Contact us, please contact us, and we'll come. We'll come and do the congregation. We'll come and do whomever if you'll just contact us. Please, please do that. As far as the COVID vaccine info line, it's up there. As far as our reminders and everything about this, over and over and over, all the health experts everywhere are just telling us how safe this vaccine is and that we've got to take our vaccine. You know, as far as getting tested and everything, I encourage anyone. We've got our free testing map up there. You know, it's painless. It just takes just a second. Special thanks to Frith and Walgreens for all they've done with the drive-through testing and all the work that they've done and everything. But take advantage of this free testing. You know, as we continue to test, remember way back when I said the more we test, the more we know. And that is ever so true. We have 11 outbreaks in our long-term care facilities. We have 5 outbreaks in our church community in 4 counties. Those counties are Berkeley, Fayette, Grant, and Nicholas, and I salute our church community again. They continue to step up, and they continue to do great work, as do our long-term care facilities. We have really, you know, way back when West Virginia started on a path of knocking it out of the park and leading the nation, we just did it and did it and did it. So a lot of great work by a lot of people. You know, corrections now has 61 inmate cases and 7 staff cases. 34 of the inmate cases are at Salem Correctional Center and 16 at the Southern Regional Jail. All the guidelines are up there. I tell you over and over about face coverings. I want to touch just 1 second about, you know, the face coverings if I could. There was a doctor, you know, and he was he was on the news today, and he was talking, you know, about inconsistencies that have come out of either Dr. Fauci or come out of the CDC, and you know, as to what we should do and what we shouldn't do and everything. And basically he said just this. He said, if you could just think of, you know, children playing with glitter, and it gets on everything. You know, it is absolutely, it gets everywhere. He said that is so much like this virus, it's unbelievable. If you'll really just think of it that way, and just think just this way, you know, if you're with people, a family, and a family has been vaccinated and everything, we all know there's really no need, if you're in a home or whatever with your family and they've been vaccinated and everything, there's no need to be wearing a mask. We all get that. But absolutely, this doctor said ever so clearly, if you go out, you get on a bus, you go in a public building or whatever it may be, you don't have any idea the people there that are currently have COVID or some of the variants. You don't have people that, you don't know the people there that have been vaccinated and have not. And so with all that, today, his advice was just this. Think about that glitter, because that's what COVID is like. It's all around us everywhere, and you can't get rid of it. It's all around you everywhere you go. And literally, in his mind, wearing that mask in a public building or on a transit bus or whatever it may be, absolutely that you should wear the mask. Now, we all want rid of them. The ticket to getting rid of those masks is one word: vaccine. Just vaccine. We've got to get vaccinated. So I remind everybody too about giving blood, especially if you've been blessed by God above, you know, and you've had this terrible, terrible killer and you've gotten over it. Absolutely, I hope that you would consider, please consider giving blood. Now, the only other thing I've got is to clean up a bunch of stuff. I'm going to read to you just a little bit, but throughout the past year, I have signed a total of 91, gosh, I would have never believed it, 91 executive orders to respond to the COVID-19 pandemic. These orders were absolutely necessary to keep our people safe, to keep our businesses afloat, and to keep us on the right track to beat this virus. And we have led the nation over and over. But it can be confusing for the public to keep track of all the different orders. So today I am signing a new executive order that's cleaning up and doing away with a great many of the executive orders that have been in place. You know, the ones that will remain in effect are orders that suspend regulations and make access to health care, business licensing, and other aspects of your life easier. I am also leaving in place the requirement that all healthcare facilities and providers in our state remain vigilant with plans for surge capacity and PPE in case we ever need it again. As far as the face coverings, I've covered that just a second ago. Finally, the new executive order will remove the social gathering limitations. This order will also reinstate some requirements for unemployment benefits that will be waived early that we waived early during the pandemic. We need to put these requirements back so we can get people back to work. I mean, and I think they'll go into effect in June. I will also be signing an order later today that will be available on all the website. So the net of the whole thing in regard to that is just one thing. There's a lot of stuff that was very valuable when we put it in. It's now lived its time, and it's time to move forward. And so we have a lot of things that were in place that we can now go back and eradicate. And many of these things, the legislature tried to address in the session, but the long and the short of it is this cleans everything up. That's all I got. Thank y'all.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. I'd just like to highlight a couple of things the Governor pointed out. We are in a race. These variants that are coming, as Dr. Marsh and Dr. Amjad will tell us, are much more contagious and can be much more detrimental to our health, as well as much more deadly. We are making good progress in West Virginia, but we still have a portion of our population that we must get vaccinated. We are also preparing for 12 to 15-year-olds going forward. But as the Governor pointed out, we need everybody to step up. Churches, businesses, civic groups, anybody that can help us put on clinics to get more people vaccinated. If you need more information related to education on the safety of the vaccines, we will get with you and provide that to you. But we need your assistance. We don't want to be that team that ends the game on the 5-yard line and misses the goal line. We've got to work this as the state of West Virginia and make these things happen and get more people vaccinated. Again, continuing to make good progress, but we've got to get more vaccinated. There should be no issues. We have plenty of vaccines available. Most all pharmacies now have vaccines, federally qualified health clinics, hospitals, other entities such as local health departments have vaccines available. Please get vaccinated so that we can end the rest of those things that we need to do for safety that the Governor's talked about. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to mention just a couple of things. When the pandemic was announced last year, March 13th of 2020, there was a decrease in hospital emergency room visits across the country. We did notice that there was a little bit of an increase in emergency room visits toward December and January of 2020 into 2021. And there was some studies that were shown that it was some infections that were seen, but also some mental health visits. So we want to just bring that to light for providers out there to note that people are still visiting emergency rooms for mental health issues in children and young adults. But that just brings to light that our mental health issues are rampant throughout the pandemic, and that is mostly due to people being isolated during this time. Also want to bring to light, and the Governor did mention this, that our testing numbers have been decreasing across the state. And if you are having any issues of a cold or any sinus infection or in large gatherings, that we do want you to visit our testing sites across the state that are still free. Thank you.
Thank you, Dr. Amjad. Next is Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. To add a little bit to what Dr. Amjad said, this is a difficult time for everyone. It is crucial that we take care of our mental health and help our family and our friends with regard to mental health. Physical distancing does not mean we stop supporting each other. Reach out to family, friends, and loved ones and check in, make sure they're all right. Providing social support and making connections is especially important in addressing the feelings of isolation that many people have during this pandemic. Talk to your healthcare provider about your mental health concerns, especially if you are experiencing acute stress that is getting in the way of daily activities for several days in a row. Additionally, people may also contact Help 304 WV, which is a 24/7 helpline, also 1-877-HELP-304, or by chatting online at help304.com. So please take care of yourself and take care of each other. And as the Governor has said, and retired General Hoyer and Dr. Amjad, please get vaccinated. Take your family to get vaccinated. We must be diligent during this pandemic and continue what we started. Thank you.
Thank you, Secretary. Dr. Clay Marsh, our coronavirus czar, had a prior engagement today, and he will join us again on Wednesday. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you expand a little bit more on, removing the limitations on public gatherings? So is that all across the board, all types of public and social gatherings? Obviously, the mask order will still be in effect, but how will this work in terms of social distancing? You can now, have as many people will fit in a space. Do we all still need to be spaced out? Thank you.
Charles, I think the easiest way to describe this is with all the businesses being opened, and they were, and the limitations taken off of the businesses and everything. There's just not any need to continue on with the with the limit as far as social gathering. And so with that being said, we absolutely need people to keep their social distancing. We need people to wear their mask and all those things, but it's almost like an unnecessary thing to have. I mean, if you're going to have no limitations on the business for the number of people that can go into the business and everything, it's kind of contrary to logic to have some kind of limitation on the number of people that can come to a family reunion or whatever.
All right, thank you, Charles. Next, we'll go to Haley Kosick with Next Star Media.
Good afternoon, everyone. My question is, can we expect to vaccinate those 16 years and younger anytime soon, or do we still have a lot of ground to cover for those 16 years and older?
Well, Dr. Amjad, you can answer this. This is a medical question more than I, but Dr. Amjad, please.
Yes, Governor. Haley, so Pfizer hasn't given the emergency use authorization for 15-year-olds yet. I mean, we are vaccinating 16 and older right now with Pfizer. We've had several family clinics to, address the 16 and older age groups right now. So we've been working really hard with the Department of Education to get to high school kids and their families to get 16 and older vaccinated with Pfizer. We are hoping to hear from Pfizer for the emergency use authorization, or the EUA that they call it, to get the 12 to 15-year-olds vaccinated. So we'll hopefully hear from them soon in the next few weeks, but we are getting the 16 and olders as quickly as possible throughout the state right now. Thanks.
Go back. I want to add one other thing. Charles, we not only do we have our businesses that are opened up, but we've, I think the date was May the 1st or whatever like that on our fairs and our festivals and everything. So, like I said, this social gathering is just not going to work. And as we, we're supportive of our fairs and festivals and things like that so it's just not going to work.
All right, thanks, Haley. Next to Emily Allen with West Virginia Public Broadcasting.
Hi there. I have two questions. Just first, where do we stand on vaccinating our prison and jail populations with the Johnson & Johnson still on hold? Are we still pivoting to Moderna or Pfizer there? And then I guess my second question would just be about vaccinations. We got a question from a listener about whether our state's vaccinated population should be concerned. Is our vaccinated population here going to be as safe as other states where more people are vaccinated, or are we going to be more susceptible to new strains or breakthrough cases? I hope that question makes sense. But those are just what I was going to ask.
Okay, General Hoyer, you got to start, and Dr. Amjad, maybe you can wrap it up.
Yes, sir, Governor. As far as corrections, we continue to work with corrections and provide vaccines. Even without Johnson & Johnson, we're making Pfizer and Moderna vaccines available to prison population. And we are continuing to work with vaccine hesitancy within prison population, just like we are general population. But that vaccination work continues. I'll turn it to Hein for the second part.
I think it was Emily. As far as breakthrough cases go, just a quick definition is when someone is fully vaccinated and then 2 weeks post that vaccination process. So, and as far as the variants go, and that's why we're racing against time, which in our case are the variants. You know, we want everyone to get vaccinated as quickly as possible, because that is one reason why we have variant cases in our country and our state right now. So to answer that simply, you know, we want, if someone was wanting the Johnson & Johnson vaccine, which is on pause right now, we have plenty of Pfizer and Moderna available. So we want people to get vaccinated as quickly as possible so that we can have less, you know, variant cases or response to breakthrough cases and so forth. But people who have breakthrough cases are less sick. That's what we've noticed so far. They tend to go to the hospital less. So that's why we want people to get vaccinated. But hopefully that answers some of your question, Emily. Thanks.
All right, thanks, Emily. Next to Phil Kabler with the Charleston Gazette-Mail.
Hi, everyone. I was expecting to go last, so I'm not quite ready. Talking about the what really are plummeting numbers for vaccination. Since April 10th, we've only had one day with more than 4,000 vaccinations administered, and according to the dashboard on Sunday, and of course there's a data lag, shows only 5 vaccinations were performed, and we assume that that number will increase, but it's still at that rate it's going to be difficult to reach the 650,000 people who are not yet vaccinated in the state. Is there any thought to looking at incentives or other encouragement, maybe financial, to get people who are reluctant otherwise to be vaccinated?
General Hoyer, maybe you can try this. You know, Phil, the only thing I would go back and just say to you is just if you were really fair and you looked at this and said, okay, we've got almost 700,000 with first doses, forget the second doses, we've got 400,000 kids, that puts us at somewhere close to 1.1 million. We've got 1,750,000 people, so we got 650,000 people out there. You know, if in fact 250 of the 650 just adamantly refused the vaccine, we'd be looking at a total population left that we can get to of about 400,000. And we're getting to that 400,000, maybe not as fast as we would like to, but we're getting, you know, we're getting a percentage of those every single day. And so if you just step back and do the math and say 700,000 first shots, 400,000 kids, that's 1.1 million. We got 1,750,000 total, at least 650,000. And if 250,000, I wish to goodness there wasn't any, but if 250,000 out of 1,750,000 don't take this shot, that's probably about, I don't know, is 17% or some number like that. Well, at 17% of the total population in the state, if those are the only ones that refuse this, you know, West Virginia would probably be leading the nation. So that leaves us 400,000 people. And a lot of those are kids, and a lot of those are students, you know, but nevertheless, we've got to get to those kids, because if we got 400,000 folks out there that we're really targeting, trying to get to, we got to get to them. And, you know, it's just a little slower, it's a little tougher and everything. You know, but we're getting there. But, you know, General, maybe you can add a little bit to that.
Yeah, and just to add to what the governor pointed out, one of the things that he tasked us to do was to engage businesses and civic groups, to open it up to families of businesses. And to your point, Phil, we do have businesses that we've been working with in vaccine clinics who have offered incentives to their employees, as well as some to family members, and to include gift certificates, as well as a couple of businesses have offered a day off to individuals to get the vaccine, because these businesses need to and want to stay open with a healthy workforce. So there are efforts in that regard in the way of incentives going forward.
Great, thank you, Phil. Governor, back to you.
Well, I thought there was going to be some more questions, almost like Phil, but so Phil, we're bonding here today. Nevertheless, let me just go through just a couple of things. First of all, we really, really and truly, should we really be paying people to get vaccinated? Really, should you be paying somebody to try to save their life? It's just, I don't know if I can see how that makes any sense. But I want to just go back and just take just a couple minutes, and I want us all to really dial in and pay real close attention as best you can, because I know this stuff, for me or for anyone, it's been a long journey, and but along the way, if we'll just step back from this, and there's a good message, I think, in what I'm going to say to you, but there was a point in time here where all of a sudden West Virginia did not have the first case. Then West Virginia did not have their first death. And then all of a sudden this thing jumped on us pretty seriously. At that point in time, just to tell it like it is, everybody was afraid. Everybody was scared. We didn't have a vaccine. We knew that getting a vaccine could very well take years and years and years, even to the magnitude that it could take 10 years. We didn't know really what was happening, but we knew that those that got this were dying a miserable, miserable death. Somewhere along the way there, we absolutely had to stop visitation to our nursing homes. And it was sad, and it was tough. And then all of a sudden, we really super aggressively, were after trying to get all of our nursing homes vaccinated. And then not long after that, if I could fast forward, we all of a sudden had many, many, many folks dying. And nobody really knew for sure when the vaccine would come. And on top of all that, we all thought that if the vaccine comes, we'll be really, really lucky if it gives us 50 or maybe 60% coverage. And then lo and behold, the miracle of miracles happened. There were vaccines. And the absolute efficiency or the coverage was 95%. Nobody would have ever even guessed that in any way. So all of a sudden you heard me talk over and over and over about a bridge. We've got to make it to the vaccine. We've got to make it to the vaccine. And all the medical experts, every last one of them, would have thought really and truly the efficiency of this vaccine may be significantly less than a flu shot. And a flu shot only gives you about 60% or 50% coverage. A flu shot, and they thought that it would be less effective than that. And lo and behold, instead of it being 60, it came in at 95%. Then we led the nation, did we not? The National Guard, the DHHR, all of our vaccination clinics, all the healthcare workers out there, everybody just jumped in with everything in the world. And to be perfectly honest, I had to sit on a few people. And I did that. And lo and behold, we led the nation over and over and over. Think about the census. Think about what we did in West Virginia with the census. Again, we led the nation, did we not? We led the nation. And absolutely, without any question, the powers to be in D.C. were absolutely all over us because we were so far behind, it was unbelievable. In all cases, what did you do, West Virginia? In all cases, what did you do? You really, truly believed in me, Dr. Marsh, Dr. Amjad, the great General Hoyer, absolutely Bill Crouch, all the different people that were in front of you every day, you trusted us. And literally, we got ourselves all the way down the field, leading the nation in every way, and now here we are today. Now, West Virginia, we have come through history like you can't imagine. Now, West Virginia, if you truly have trusted us, and we truly, without question, have produced numbers like nobody else, and without any question whatsoever, we have saved countless lives. If you truly, truly trust us, now you've got to step up again, do you not? Now we still have that 400,000 or whatever that are out there that would give us across the finish, across the finish line, that would be spectacular. West Virginia, you absolutely became community captains, neighborhood captains. You helped us. You helped us beyond belief. Now, I ask you with all my heart, help us get across the finish line. You've trusted us. You've believed in us. Without any question, we can continue to lead this nation in every way. This isn't a contest to lead the nation. This is a contest to live, to get back to normalcy. This is a contest, West Virginia, not to have bragging rights. It's great to do that because it makes West Virginia look great. But West Virginia, you have done this. Now, literally, I could sit here and say, well, we've told them. Excuse me. We've advertised, we've done this and we've done that. We've told them. And if they don't want to go get their shots and they don't want to be vaccinated, well, more power to them. But I know you better than that. I know you. The one thing you can say about me is just this. I've always told you the truth. I've always spoken from my heart. But I know you, West Virginia, and I've always known you, and that's the only reason on the planet that I ran for governor, period. First time or second time. I've known how great you really are. I've known how family-based, faith-based you are, family-based you are, neighborhood-based you are. I have absolutely known you and loved you my entire life. And you've blessed me beyond belief. Now, really and truly, I got to have you one more time. Because if you will really bear down, and we'll truly have the team captains, and we'll truly have the neighborhood captains, and we'll truly, truly do what we did in the census, we can get ourselves across the finish line. And if we do, in this great state, we will celebrate all the goodness like you can't imagine. The primary goodness is we will save lives. It'll be your life. Absolutely, we will save lives. Now, come on. You got to really help me right now. I've given you the history from absolutely when we didn't even have a case till all of a sudden we had outbreaks and people dying. We absolutely went right down the path and boom, 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 boom. We did it, and we did it right because of you. Because of you. You were all in. You were all in all the time. Please, please don't drop your guard now. Absolutely, there's been too much work, too much good work. Now, I got to have you one more time because I cannot ensure the safety and the well-being of all of us if we're not vaccinated. Now, I fully expect there to be 250,000 people in the state of West Virginia that just absolutely will turn their nose up at this and say, no, 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 no. You know, I knew if I took this, I was going to get a brain tumor. I mean, literally. Do you realize now they're coming out and saying that if you get COVID, you have an 8 to 10 times greater chance of developing a blood clot from COVID than taking the vaccine. 8 to 10 times the amount, you know, the chance. Do you realize that that vaccine, Johnson & Johnson, in Pfizer and Moderna, we haven't even heard of anything bad. But in that vaccine, there was like 6 or 8 or whatever out of millions and millions and millions of vaccines given. Your chances of giving this to a loved one or getting this yourself without that vaccine, they're off the chart. They're off the chart. And so, absolutely, help us, West Virginia. That's all I can say to you, and I mean that from the bottom of my heart. We have climbed this very difficult mountain and navigated our way through it just absolutely almost as perfectly as you can do it. And now we're right at the top. We're right at the top where it always gets the steepest, and we got 400,000 people here. My basketball team, 100% of them, you know, in my absence, turned it down. My basketball team. You know, absolutely, I got to do better. You got to do better. We got to have you like we had you in the census. Come on. Let's finish this job. We're really, really close. It's time to win the game right now. Right now. Right now is the time to win the game. You know, the game's ours to win. Right now is the time to win the game. Thank you all so much. I love you, and I mean it. I always will. Thank you again.